2026 Mental Health Social Media Practice Review. Question 1. In a patient with schizophrenia, which of the following symptoms would indicate a poor prognosis? Option A. Auditory hallucinations. Option B. Paranoia. Option C. Flat affect. Option D. Delusions of grandeur. The correct answer is option C. Flat affect. A flat affect, characterized by a lack of emotional expression, is often linked to a poorer prognosis in schizophrenia. It can hinder social interactions and affect the individual's ability to engage in therapy or. Question 2. What information should the nurse provide in patient education for a patient-prescribed sertraline for major depressive disorder? Option A. Take the medication with food. Option B. It may take several weeks to feel the full effect. Option C. Avoid consuming grapefruit while taking this medication. Option D. Regular blood tests are necessary to monitor levels. The correct answer is option B. It may take several weeks to feel the full effect. Patients prescribed sertraline for major depressive disorder should be educated that it may take several weeks before experiencing the full therapeutic effects of the medication. This delay in onset of action is. Question 3. In managing a patient with anorexia nervosa, which initial treatment goal is most important? Option A. Addressing distorted body image. Option B. Restoring nutritional status. Option C. Resolving family conflicts. Option D. Increasing social interactions. The correct answer is option B. Restoring nutritional status. The most crucial initial treatment goal for anorexia nervosa is restoring nutritional status. This is essential to prevent life-threatening complications associated with severe malnutrition, such as organ damage and. Question 4. When assessing a patient with major depressive disorder, which symptom would most likely be observed? Option A. Euphoria. Option B. Anhedonia. Option C. Increased energy. Option D. Racing thoughts. The correct answer is option B. Anhedonia. Anhedonia, the inability to feel pleasure in activities that were once enjoyable, is a hallmark symptom of major depressive disorder. Patients with major depressive disorder often experience a pervasive feeling of. Question 5. In assessing a patient for signs of serotonin syndrome, which of the following symptoms would be consistent with this condition? Option A. Hypotension, bradycardia, hypothermia. Option B. Hypertension, tachycardia, hyperthermia. Option C. Hypotension, tachycardia, hypothermia. Option D. Hypertension, bradycardia, hyperthermia. The correct answer is option B. Hypertension, tachycardia, hyperthermia. Serotonin syndrome is characterized by a triad of symptoms: hypertension, tachycardia, and hyperthermia. Therefore, the correct answer is B. Hypotension, bradycardia, and hypothermia. Choice A are not typical. Question 6. Which of the following is a negative symptom of schizophrenia? Option A. Hallucinations. Option B. Delusions. Option C. Alogia. Option D. Paranoia. The correct answer is option C. Alogia. Alogia, also known as poverty of speech, is a negative symptom of schizophrenia. It refers to a reduction in the amount of speech or the feeling that one has nothing to say. Hallucinations and delusions are positive. Question 7. Which intervention is particularly well chosen for addressing a population at high risk for developing schizophrenia? Option A. Screening a group of males aged 15 to 25 for early symptoms. Option B. Forming a support group for females aged 25 to 35 with substance use issues. Option C. Providing coping skills information to a group aged 45 to 55. Option D. Educating parents of developmentally delayed 5 to 6-year-olds on early intervention importance. The correct answer is option A. Screening a group of males aged 15 to 25 for early symptoms. Screening males aged 15 to 25 for early symptoms of schizophrenia is a well-chosen intervention, as this age group is at a higher risk for developing the condition. Early identification can lead to timely treatment. Question 8. How do epidemiological studies contribute to improvements in care for individuals with mental disorders? Option A. Providing information about effective nursing techniques. Option B. Identifying risk factors that contribute to the development of a disorder. Option C. Identifying individuals in the general population who will develop a specific disorder. Option D. Identifying which individuals will respond favorably to a specific treatment. The correct answer is option B. Identifying risk factors that contribute to the development of a disorder. Epidemiological studies play a crucial role in identifying risk factors associated with the development of mental disorders. By pinpointing these risk factors, healthcare providers can implement preventive measures. Question 9. The healthcare provider is providing medication education to a patient who has been prescribed lithium to stabilize mood. Which early signs and symptoms of toxicity should the healthcare provider stress to the patient? Select one that does not apply. Option A, increased attentiveness. Option B, getting up at night to urinate. Option C, improved vision. Option D, an upset stomach for no apparent reason. The correct answer is option C, improved vision. Lithium is a mood stabilizer commonly used for bipolar disorder, but it has a narrow therapeutic index, making early recognition of toxicity crucial. The correct answer is C, improved vision, because this is never. Question 10. A patient with obsessive-compulsive disorder, OCD, is undergoing treatment with an SSRI. Which SSRI is commonly utilized for this condition? Option A, fluoxetine. Option B, citalopram. Option C, paroxetine. Option D, escitalopram. The correct answer is option C, paroxetine. Paroxetine is a selective serotonin reuptake inhibitor SSRI commonly prescribed for obsessive-compulsive disorder due to its efficacy in managing OCD symptoms. While different SSRIs may be used based on individual. Question 11. A patient with generalized anxiety disorder, GAD, is prescribed buspirone. The nurse understands that buspirone is different from benzodiazepines because it, option A, has a high potential for abuse. Option B, works immediately to relieve anxiety. Option C, does not cause sedation. Option D, is used for short-term treatment only. The correct answer is option C, does not cause sedation. Buspirone is different from benzodiazepines because it does not cause sedation. Unlike benzodiazepines, buspirone has a lower potential for abuse and does not cause the sedative effects commonly seen with. Question 12. When using therapeutic communication with a withdrawn patient who has major depression, an effective method of managing the silence is to: Option A, engage in a quiet meditation. Option B, ask simple questions even if the patient will not answer. Option C, use the technique of making observations. Option D, simply sit quietly and leave when the patient falls asleep. The correct answer is option C, use the technique of making observations. Using the technique of making observations is an effective method of managing silence when communicating with a withdrawn patient who has major depression. This approach can encourage the patient to engage and feel. Question 13. Which intervention should the nurse implement when caring for a patient demonstrating manic behavior? Select one that doesn't apply. Option A, monitor the patient's vital signs frequently. Option B, keep the patient distracted with group-oriented activities. Option C, provide the patient with frequent milkshakes and protein drinks. Option D, reduce the volume on the television and dim bright lights in the environment. The correct answer is option B, keep the patient distracted with group-oriented activities. When caring for a patient demonstrating manic behavior, it is crucial to monitor vital signs frequently to ensure the patient's physical health is stable. Providing nutrition, such as milkshakes and protein drinks. Question 14. When caring for a patient with major depressive disorder prescribed an MAOI, what type of food should the nurse educate the patient to avoid? Option A, high-protein foods. Option B, high-fiber foods. Option C, tyramine-rich foods. Option D, low-fat foods. The correct answer is option C, tyramine-rich foods. Patients prescribed MAOIs need to avoid consuming tyramine-rich foods as these can lead to hypertensive crises. Tyramine is found in various foods like aged cheeses, cured meats, some types of beer, and fermented. Question 15. A nursing student new to psychiatric mental health nursing asks a peer what resources he can use to identify the symptoms present in a specific psychiatric disorder. The best answer would be: Option A, Nursing Interventions Classification, NIC. Option B, Nursing Outcomes Classification, NOC. Option C, NANDI Nursing Diagnoses. Option D, DSM-5. The correct answer is option D, DSM-5. The DSM-5 is the standard classification of mental disorders used by mental health professionals in the U.S. It provides criteria for diagnosing different psychiatric disorders based on symptoms and clinical. Question 16. A healthcare professional is teaching a patient about relaxation techniques to manage anxiety. Which technique is the healthcare professional most likely to recommend? Option A, deep breathing exercises. Option B, physical exercise. Option C, mindfulness meditation. Option D, journaling. The correct answer is option A, deep breathing exercises. Deep breathing exercises are a widely recommended technique for managing anxiety and promoting relaxation. By focusing on deep, slow breaths, individuals can activate the botus relaxation response, leading to Question 17. Carolina is surprised when her patient does not show for a regularly scheduled appointment. When contacted, the patient states, "I don't need to come see you anymore. I have found a therapy app on my phone that I love." How should Carolina respond to this news? Option A. That sounds exciting, would you be willing to visit and show me the app? Option B. At this time, there is no real evidence that the app can replace our therapy. Option C. I am not sure that is a good idea right now, we are so close to progress. Option D. Why would you think that is a better option than meeting with me? The correct answer is option A. That sounds exciting, would you be willing to visit and show me the app? Carolina's best response is A. That sounds exciting, would you be willing to visit and show me the app? Because it demonstrates openness, curiosity, and a patient-centered approach. By validating the Question 18. A patient with schizophrenia is experiencing auditory hallucinations. Which nursing intervention is most appropriate? Option A. Encourage the patient to ignore the voices. Option B. Provide a structured and safe environment. Option C. Engage the patient in a debate about the reality of the voices. Option D. Ask the patient to describe the content of the hallucinations. The correct answer is option D. Ask the patient to describe the content of the hallucinations. The most appropriate nursing intervention when a patient with schizophrenia is experiencing auditory hallucinations is to ask the patient to describe the content of the hallucinations. This intervention helps assess. Question 19. Which response by a 15-year-old demonstrates a common symptom observed in patients diagnosed with major depressive disorder? Option A. I'm so restless. I can't seem to sit still. Option B. I spend most of my time studying. I have to get into a good college. Option C. I'm not trying to diet, but I've lost about 5 pounds in the past 5 months. Option D. I go to sleep around 11 p.m., but I'm always up by 3 a.m. and can't go back to sleep. The correct answer is option D. I go to sleep around 11 p.m., but I'm always up by 3 a.m. and can't go back to sleep. Major depressive disorder (MDD) is characterized by persistent sadness, anhedonia, and neurovegetative symptoms like sleep disturbances, appetite changes, and psychomotor agitation or retardation. The correct Question 20. When attempting to determine a teenager's mental health resilience, what assessment question should the nurse ask that is not applicable? Option A. How did you cope when your father deployed with the army for a year in Iraq? Option B. Who did you go to for advice while your father was away for a year in Iraq? Option C. How do you feel about talking to a mental health counselor? Option D. Why would you think that is a better option than meeting with me? The correct answer is option D. Why would you think that is a better option than meeting with me? Assessing a teenager's mental health resilience involves exploring coping mechanisms, support systems, and attitudes towards seeking help. Option D is not relevant to assessing resilience but rather focuses on the Question 21. In treating social anxiety disorder, which medication is commonly prescribed to patients with this condition? Option A. Methylphenidate. Option B. Sertraline. Option C. Lithium. Option D. Haloperidol. The correct answer is option B. Sertraline. Sertraline is a selective serotonin reuptake inhibitor (SSRI) commonly used to treat social anxiety disorder. SSRIs are a first-line pharmacological treatment for social anxiety disorder due to their effectiveness in Question 22. Which of the following is a common side effect of benzodiazepines prescribed for anxiety? Option A. Insomnia. Option B. Weight gain. Option C. Drowsiness. Option D. Increased appetite. The correct answer is option C. Drowsiness. Drowsiness is a common side effect of benzodiazepines prescribed for anxiety. Benzodiazepines work by depressing the central nervous system, which can lead to drowsiness as a side effect. This sedative effect is Question 23. A client is diagnosed with somatic symptom disorder. Which question will help the nurse develop nursing diagnoses for this client's plan of care? Option A. Are you satisfied with your appearance? Option B. Do you take medication for anxiety as prescribed? Option C. When did you last feel detached from your environment? Option D. How long have you had these memory problems? The correct answer is option B. Do you take medication for anxiety as prescribed? In clients with somatic symptom disorder, it is crucial to assess their adherence to medication for anxiety as prescribed. This question helps the nurse understand the client's treatment compliance, which can impact. Question 24. A patient with obsessive-compulsive disorder (OCD) is performing a ritualistic handwashing routine. What is the nurse's best initial response? Option A. Interrupt the ritual to help the patient gain control. Option B. Allow the ritual but set limits on the duration. Option C. Ignore the behavior to avoid reinforcing it. Option D. Encourage the patient to stop the ritual and discuss their feelings. The correct answer is option B. Allow the ritual but set limits on the duration. In managing a patient with OCD engaging in ritualistic behaviors like handwashing, the nurse's best initial response is to allow the ritual but set limits on the duration. This approach helps in managing the behavior. Question 25. Which response demonstrates accurate information that should be discussed with the female patient diagnosed with bipolar disorder and her support system? Select the incorrect one. Option A. Remember that alcohol and caffeine can trigger a relapse of your symptoms. Option B. Due to the risk of a manic episode, antidepressant therapy is never used with bipolar disorder. Option C. It's critical to inform your healthcare provider immediately if you are experiencing sleep disturbances. Option D. Is your family prepared to be actively involved in helping manage this disorder? The correct answer is option B. Due to the risk of a manic episode, antidepressant therapy is never used with bipolar disorder. In managing bipolar disorder, it is vital to educate the patient and their support system about triggers like alcohol and caffeine, the significance of good sleep, and the need for family involvement. However, the